as a recap, you said it in passing, but I'm just going to say it again. We have two kidneys. What is its significance? What does it mean? God has given us all two kidneys, and people ask, or people say you can survive on half a kidney or one kidney. How true is that? If you can tell us something from the expert point of view.
So as I said, we have two kidneys, but I don't know why God gave us two. Possibly God knew that one day we will be doing some transplant. So I mean, but we can live on one. One can perfectly function as two. So I mean, I mean, just that is it. If you have one kidney, you can function. I think I said last week that there are people that incidentally we find that they have just one kidney. Possible they might come in with something else, and we tell them go and do a scan. And these people are purposely at the age of 50, 60 years, they've lived all their life. And you realize that they just have one kidney and they've lived with that one kidney all their life and they are perfectly fine. So we can live with one kidney. Thank you.
All right, thank you very much. Somebody is asking, is there any possibility that dialysis will not work for any particular group of people?
Oh, dialysis will work for everyone who has end-stage kidney disease or kidney failure. It will work for anyone. It's
Okay.
just the cost and the inconvenience.
All right, all right. Now you said the frequency of the dialysis is about 3 times per week, and each session lasts a minimum of 4 hours.
Yes, it's to last for a minimum of 4 hours to get a better outcome.
To get a better outcome, and it's about 3 sessions per week.
Yes, please. So let me just, I forgot to say something. So it's 3 sessions per week, but what 98% of our patients in Ghana here are doing two sessions, even though it's not what is recommended. You understand? So for you
Why is
to,
that so?
the cost is expensive. It's very expensive. So let me give
How
you
much? How much is a session?
now we are yet to so you let me give you a session per other peripheral facilities. I will
Yes.
not want to talk about Kolebu here.
Yes.
So other peripheral facilities, a session is I think the lowest we can get is about 550 to 600 cities, and the highest we can get is 700 to 800 cities.
So a
So
session costs about
let's
600
use
Ghana cedis.
okay, so let's use 600.
Yes.
600 times 3
1,008.
times 4.
That's a lot of money. Let me do the
That's a
calculation
lot. It's
quick.
about 5,600 cities, something
I'm
like that.
telling you.
Uh-huh. And that is just dialysis. And
No.
I told you dialysis only functions, just does the excretory function and also the regulatory, like removal of fluids, removal of urea, but it doesn't do the hormonal function. So you need extra medications like erythropoietin that the kidney needs to produce. The dialysis cannot produce that. And that one we have about 100 cities. So you need twice in a week. So like 200 cities per session. So you get about 400 cities in a week. Then the iron to you get about 100 cities. So let's say 200. So that alone is about, let's say, 400 cities. So 400 cities plus plus the 1,008 cities per week. So you end up spending about 2,200 cities or 2,300 cities per week just to get a for you to get good dialysis and to just act normally. I mean, to have a normal life. You understand? Times
Yes.
four, so 2,000 cities times four, you end up having about, let's say, 6,000, 5,000. And how much is our minimum wage, and how much are we do we get in a month? So the risk factor. Look out for these things that will cause the kidney damage, and we should help. We should make sure that we prevent that. Thank you.
Yes. Doc, thank you very much for putting it into financial perspective. Just to rehash what doctor just said, a minimum of 1,008 per week adds up to 7,200 for just the dialysis. Then you're going to spend about 100 Ghana cedis on erythropoietin and about similar on other things. So totally you're spending about 8,000 minimum. That is if you get it at 600. But if you go to other facilities that do it for 700 and 800, you're going higher. And aside this, you're going to be on other medications as well. Now, putting it into dollar perspective for our foreigners, we're talking about you're spending about $700 per month, about $700 to $1,000 per month. So what doctor is championing, that's why he readily accepted to make time for us all these back-to-back 2 weeks, is that let's focus on mitigating the risk factors. Make sure we do things that does not expose us to having kidney injury or damage. And even if you have the kidney injury or damage, let's make sure we adhere to the doctor's prescription, the doctor's advice, so that it doesn't progress to kidney failure. That is the one he doesn't want us to get to. All right. Thank you very much, Doc. There are a lot of questions coming. I'm going to send another question. Someone is asking. I want to ask, is it good to replace honey in our porridge than sugar?
All right. So I mean, it's the same whether you take honey or sugar. Is the same. Is the same. The value is the same. So
Thank you.
I mean, but it doesn't
It's true.
add anything. Yeah.
Yes, because I have spoken to a dietitian and he said that there's no difference. It's just for marketing purposes. People say honey is better than this. Guys, from the scientific point of view, they don't find any difference. Somebody is asking, doctor, kindly recap on what we have to do to have a healthy kidney, the foods we have to eat and not to eat. Thank you.
So I said that it's just the same food that we are to eat to prevent other diseases or conditions, lifestyle related diseases like patients for heart attack, hypertension, diabetes, stroke, and even so just normal lifestyle. I mean, this for people who do not have kidney failure. I mean, I just need to specify. So you eat your more vegetables, less fatty food, less carbohydrates, exercise very well, drink a lot of water, and live a stress-free life. You are fine. And also try to look out for risk factors, and you are fine. You are done.
Good. Somebody's asking, Doc, is there any home test to prove for oneself as to whether or not their kidneys are healthy?
Oh, should I say no? I don't think there's a home test, but there are simple tests. The kidney function and even your urine test. So the urine test, sometimes they might see some protein, some blood in it, but I mean, if it's interpreted very well, they might tell you, oh, maybe your kidney is at the damage point. So let's see what is happening. So, I mean, there's no home test, but you can have simple tests, which we can always do. Your kidney function test or your urine test. I mean, you just check possibly what is in it. And that can be of help. Thank you.
Okay. Somebody is also asking, doctor, and I'm happy somebody has brought it up. And one of the reasons why we are doing this is because of these things that go on in the market. Somebody is asking, there are some drugs in the market that claim to repair damaged kidneys. We want to know, is it true?
So I know that one I can accurately and confidently say no. When your kidneys are damaging, it is very difficult for your kidneys to revive because of the nature and how the kidneys are is. I mean, so the cells of the kidneys are not a regenerating type of kidney cells. I mean, most of that. I mean, so that's something that I need to know. So everything, those things that are being so sometimes I am asked, doctor, is there any medication that I can take to reverse your kidney or to reverse my kidney failure? No, I will tell you completely no. If you have kidney failure, I'll tell you the only thing is the dialysis or the transplant. anyone you opt for, then you go further. I mean, that is it. So there's no medication to bring your kidneys back. However, if we find out that you have some damage, a bit of a damage or kidney failure at early stages, we can give there are some. We'll just treat the risk factor. We tell you to drink water and give you medications to reduce the progression to kidney failure or end stage. So that is what we do. Nothing else. Please.
It's very important that those of us who are logged on live or who are going to listen or watch this video know that there is absolutely no medication, whatever, that has been discovered yet, that is going to reverse kidney failure to normalcy. None whatsoever. Those people are charlatans. They just want your money. They're going to dupe you because they know you are desperate. The aim is prevent the kidney injury or damage, and or stick to doctors' prescribed advice and medications to prevent further progression of the damage so that you don't end up with kidney failure. Doctor, have I said it right?
Yes, please.
Okay, somebody's asking for the BP machines. There are several brands and models on the aisle. Which one do you recommend?
Oh, I don't have any preference to that, so I don't know basically. So I think.
And I know why
Yeah,
doctor is doing that, because
yeah.
he's not allowed to mention
It's not.
brands.
Yes,
That's
yes,
our
yes.
training.
Yeah.
Guy, don't worry. We are not allowed to mention brands, especially so that we are endorsing them and all that. So he's just remaining a professional. Somebody is saying, Doc, are you saying coconut is doing me more harm than good?
So you see, I said something that I have divided. I mean, I made mention that we need to avoid when you are at the point that you have a risk factor, or let's say, let me go back a bit for you to understand what I want to say. Okay, so when you are at this point, you can take your coconut, you can take your how do we call it, banana and anything. That one you don't have a kidney failure. You can drink water. You have to live a healthy life. So this one you are not told to restrict certain diet like coconut water. But when you get to kidney failure, the coconut contains a lot of potassium and a lot of and also you can have that for banana and plantain. They all have a lot of potassium. And I told you that the kidneys, if they are functioning very well and you take in a lot of potassium, you pour out the potassium, or the potassium will go out because the kidneys are functioning. I don't know whether you understand. So it is only those who have the end kidney failure, who have gotten end stage and they are on dialysis or they require dialysis. Those are the people we tell them not to take in. They need to avoid the coconut. They need to avoid the banana, the plantain, the fruits, and a lot of things in order not to for them not to die because of high potassium or other electrolytes. I don't know whether I have he understands what I said.
Yes. So let me just rehash it again. Maybe what doctor is saying is that at the level where you don't have any problem with your kidneys, ideally, feel free, drink water, take coconut juice. Make sure you just watch the risk factors so you don't have kidney injury or damage. But when you have a kidney problem, injury, damage, where they don't want you to overload yourself with too much potassium, those food that he's mentioned, coconut, plantain, banana, they contain naturally higher levels of potassium. So you will be advised by the expert. So don't just do it on your own. Go and let the expert do the test and advise you. You'll be advised to avoid them as much as possible. That's exactly what you are saying, right?
Yes, please. Yes, please.
Good. So for now, if you have no problem with coconuts, with your kidneys, go ahead and drink your coconut as much as you want. Take your banana, but make sure you watch out for the risk factors. All right. Somebody is saying a very important question. Is it possible to follow all these and still wake up one day to a failing kidney? Is dialysis covered by national insurance? Please, the second part today.
Okay, thank you. I think the first question is a very, 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 very important question.
Yes.
I told you that there are now a different group of patients that we are trying to know why they have kidney disease. They have followed all the healthy lifestyle, eating well, then all of the sudden they get kidney disease. So you see, during my presentation, I told you that looking at the third point, screening to detect early kidney disease. These are especially people who we don't know why they are getting the disease, especially. That's what I want you to know. So that if there is something we can do to prevent it from going bad to the kidney failure, let's see, at least we control certain things. We tell you to take this medicine so that it doesn't go bad faster. Even though eventually it will go, but I mean, we can slow it down, small, 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 so that you don't get to end stage. I mean, So that is a very, very true thing. But as I said last week, that we've also realized that this group of people might be taking, maybe if you go take your history very well, they might be taking some things, or they are in this Galamsey areas and all these things. Still, there are a lot of things that are going on that you don't know. So the one that we can catch, the one you know, just make sure that you work on it. The risk factors that you know, work on it very well, and just pray that you will not be affected by the unknown side. I mean, that is what I can say. Thank you.
Then the second question was, is it covered by insurance?
Please no,
Okay, it's
it's
not
not
covered.
covered. So yeah,
Okay,
it's a very it's a very expensive thing. So I mean,
yeah.
yeah, yeah.
Somebody asked a very good question. How much does it cost to do a kidney function test?
Okay, so I think currently the one that we had is in June. I think it was about 22,000 US dollars for everything. And this I can say is the cheapest. I mean, the one we do in Ghana, because we have other places that I mean have the give kidney transplant. So in South Africa, you are going to spend about almost 100,000 US dollars. In US, you are going to spend about 400,000 US dollars. In India, you are going to spend about I think 50 or 40,000 US dollars. And aside that, if you are transporting somebody to go and have the transplant, the donor, you have to pay for the hotel, especially when you are out. You pay for the hotel, you pay for a lot of things, and it's very expensive. The ticket and all these things makes it expensive. But in Ghana here, I think all these things are out, and we realize that when we cost them and uh, we cost everything, we realize that it's just 22,000 US dollars. If that is ready, at least we can start something, and I mean we can have the transplant can be done for you. Thank you.
Okay, so the question Doc answered was the cost of kidney transplant. And he's saying in Ghana, you can spend about 22,000 US dollars. True, right?
Yes, yes.
But it's more expensive outside. Outside, it's about 50,000 to 100,000 US dollars. But in Ghana, currently, you spend about 22,000 US dollars. Now, the question someone is also asking is, what is the cost of a kidney function test, BU creatinine?
Oh, it's not expensive. I think 50 cities, 60 cities.
So with
Yeah,
50
and
Ghana cedis, you can have your kidney
60,
function
yeah,
test
60,
done.
70, yeah, it depends. Yeah.
But the kidney transplant itself, currently they do some in Ghana, because you go through rigorous testings and everything. You have to also get a suitable donor. That's another issue. So that's about 22,000 US dollars currently in Ghana. But outside, it ranges from 50,000 to about 100,000. And of course, there will be other charges. If you are going there, you are the flight for yourself and relatives. And I know people who have gone to do it in US and back, and they have to go there with relatives, with the donor. They have to do a lot of tests within 3 to 6 months before they fly out, and it's quite expensive. Doc, what advice would you give someone who is opting to donate his or her kidney to a friend, a loved one, or a relative, what advice would you give that person?
It's a good thing, very good thing. We can, as I said, we can live with one kidney, but uh, you, the donor, will also will require to go through some tests. If they realize that there's one or two things that later in life can affect you, they will advise you not to go. But it's a very, very good thing. We will encourage that because our patients are dying. We want people to donate, and I mean, to their loved ones. But we will also want to also protect you, the donor, by also going through a lot of tests and investigations to make sure that you are really safe. If you are safe, then we will allow you to give one of your kidneys. We can assure you that if you have one kidney, you can live a very healthy life. You can survive on it.
Just to play the devil's advocate, the person who has donated, the donor, is he at any risk in terms of health? Apart from the
No.
surgical risk, is it like,
Oh
for
yes.
example,
It's you see the surgical risk. You see when
no,
you even for the surgical risk is minimal, like seriously minimal. After 3 or 4 days, they are even discharged from the ward. I mean, after post surgery. But it's the ones that have the recipients, those who receive the kidney, are the ones that are in the ward for about 2 or 3 weeks before they are discharged.
all right.
So there's no risk. Yeah, they are
But what I'm
fine.
asking
They live
is,
a healthy life.
now that individual is with one kidney, all right?
Yes. Mhm.
Does that have any special risk, anything to be aware of before the person
Oh,
embarks on the journey?
very good. Okay, I like the question. So it also goes back to the same thing, risk factors, risk factors, risk factors. I don't know. Yeah, risk factors. Risk.
All right. Okay. So the person also has to be on the lookout for the risk factors, trying to make sure he also doesn't get to kidney injury or damage so that he doesn't end up with failure. That's what you're trying to say, Doc. Okay. Thank you very much. Doc, are you back?
Yeah, I'm back. I'm back. I
Okay.
had it.
No, see, trust me, I appreciate the fact that you are still here with us. So Doc is very busy, has a lot of clients, he's doing a lot of things, but making time to be with us, we appreciate it so much. Doc, there's a question. Somebody is saying, can adults receive a child's kidney?
Ah, okay. So, yes, you can, but ethically, it's a bit difficult for us. Let me use that word. You see, even when you are donating, right? We go through some ethical procedures, letting the donor. We must know that the donor is not coerced to give the kidneys. We must also know that the donor is willing to give the kidneys, and also it is not to pay for the kidney, especially the monetary aspect is very important. If we get to know that, we will also disqualify you from getting the donor. Even though we know people secretly are doing it, but if we get to know, we will disqualify you. You are not going to have your kidneys, the transplant. Yeah. I don't know whether you understand that.
Yeah, okay. So somebody asking a very good question. What's the effect of alcohol on our kidneys?
Yeah, so smoking, alcohol smoking, eating bad, eating late, all those things, they all can affect your kidney. They can affect your heart. They can affect your brain. They can affect anything. And I mean, I'm not saying alcohol as in just taking alcohol, but excess alcohol. Excess alcohol. I don't know whether you understand.
Yeah, that's well noted. And somebody is asking, how long will a person undertake dialysis to get well?
If you are placed on dialysis, you are placed on dialysis for life because your
That's
kidneys are
it.
not working.
That's it.
So
There's
you
no
do the
reversal.
you just do your 3 times in a week. Pay get at least you make sure that in a month you get 6,000 CDs ready to get your good dialysis, and I mean that is it. And this you have it for the rest of your life until God calls you.
Yeah, that is the point we want to drive home. Once you get to that stage of kidney failure where your doctor says you need dialysis, it's not like the kidneys are going to get better after dialysis for some time. No. The dialysis machine, as doctor said, is not doing the work of the kidneys because they're not able to do that. And you have to be on it till God calls you or until you get a good donor to undergo a kidney transplant. You understand? So that is why prevention is what we are all trying to champion, that we don't get there. Fortunately, a lot of people are getting there. That's why they're there. So it's important that after we finish with this session, you help us to share the recording so more people get to learn and know what to do and what not to do. All right. Somebody is asking, how much is a dialysis machine?
Oh, I don't know the cost, but it's very, very expensive. I don't know, but I think is it about um,
No, people who have money, do some
twenty
people have personal
thousand US
dialysis
dollars.
machines?
Yeah, they can. You can get one at home, your own personal one.
Hey,
So
Charlie.
you get a dialysis machine at home. It's not just getting the machine, but the consumables that is involved. It's
Yeah,
also very expensive, and also a a caretaker. I mean, a nurse who is trained to dialyze and look out for complications during dialysis. I
yeah,
mean, so that is very important. Yeah.
yeah, yeah, yeah. Gakenke, they are not saying just 20,000. They say it's not just about the machine, it's about the consumable, the things you have to add on. And of course, the expertise, the expert who will come and operate it and monitor you, and all that adds up to a lot of money. That's why a lot of people don't just own it. So those who can afford a dialysis machine, they rather go and look for kidney transplants to do. I'm sure that's what most people would do. Somebody's asking, so okay, if you have any last minute question, please drop it in the chat box in the comment section on Zoom or on YouTube. And our expert is still on the line to help us get to know what we should do to prevent kidney failure. That is how to prevent it. That is what we are hoping for, because from what he has taught us today, once you are put on dialysis, every month you have to look for your 8,000 Ghana cedis to go through it every single month. And currently in Ghana, I know for sure that is a lot of heavy burden. All right. How much is our salary for you to now have a relative, a friend, or yourself going through dialysis and you are spending 8,000 Ghana cedis? We did a calculation together. So, guys, it's in our interest to watch the risk factors: alcohol, too much alcohol, excess alcohol, hypertension, diabetes, too much over-the-counter painkillers. Doctor said he himself doesn't remember the last time he's prescribed any of those painkillers we call NSAIDs, diclofenac, brufen, and the rest. He said he doesn't remember the last time he prescribed it. Why? Because he is in a space and he knows the damage it can cause. Somebody recently spoke to me that he traveled to China and they don't have over-the-counter NSAIDs at all. It has to be prescribed by a doctor. That is how much the system is trying to protect the citizens from developing kidney issues. All right, so thank you very much, Doctor. Okay, somebody is saying, Doc, you did well. This should be incorporated into the SHS curriculum. Oh, trust me, they do. There's some level of training, but sometimes it's not taken serious until people begin to have issues. Last minute questions. Doctor is on the line. I'm trying to find out what I can ask him. So dialysis so Doc, if you have the option of going for kidney transplants and dialysis, which one will you go for?
Yeah, I'll go for the kidney transplant. The transplant, yes.
Okay. Now, if somebody starts the dialysis at a point, can that person now graduate to want to opt for the transplant?
Oh yes, even before you have a transplant, you have to have adequate dialysis for your body to be in the right state. So that is it. Before you go on transplant, so it's important.
Okay. So the new kidneys that you have gotten, there's a risk of rejection, like you rightly told us. And also, is there a risk of that kidney also failing?
Yes, it can fail. If you go back, so you go back to the risk factors again. You go and you are smoking, you are eating anyhow, the kidney will fail within the shortest possible time. You can have it. There are some people who have it for only 1 year and they are back on dialysis. So
you mean there are people who have had a new kidney and they are back on dialysis?
yes, and because they've gone back to their old lifestyle, risk factors, they are not taking their medications, they are not, I mean, you can go back immediately.
How stubborn can these people be? Or they don't understand what they are going through? Okay, Doc, what is the effect of stress on our kidneys, on dialysis?
So what I said, stress is number one cause of it causes you to have very high BP sometimes, because there are a lot of should I say a lot of this thing being produced, stress hormones that are produced, and stress hormones actually can increase your blood pressure, and high BPs will actually cause you to have kidney failure. So stress is also a very important aspect. I mean, not directly but indirectly.
Thank you very much. So stress, in as much as whatever it is we're doing, we have to watch stress in my space. Stress underlines a lot of things that happen to people in the space that I work in mostly. So I know stress is something we all should try to avoid. Doc, thank you very much for taking time to take us to the functions of the kidney. The excretory function, the regulatory function, the hormonal function, and the risk factors for kidney diseases, kidney failure, and how to prevent it, and the treatment modalities. You have been very thorough, and we are very grateful for these past 2 weeks. We know how busy you are, but you've made time to serve us well. We appreciate your time so much. What is your final words to us as we learn and depart from this session?
So my final word is, please, the most important thing to know is to look out for the risk factors, the causes, avoid them, or even if you are told you have diabetes, you have hypertension, you just need to control them. Take your medications, see your doctors, have your regular checkups, because that is what is going to prevent us from getting the damage or getting you having a reduced kidney function and the failure. So all what I would say is that prevention is better than cure. Even there is no cure here for kidney failure, it is more of treatment or renal replacement therapy. So it's better to prevent it. Prevent it at the level of the risk factors, nowhere else. Thank you.
Thank you very much, Doctor. And of course, to all of you, our audience, live audience on Zoom and on YouTube, we appreciate you so much. Those of